Hello everyone, I'm Poshnali. Today we have came to the Facebook Live American Oncology Institute, Hyderabad. So today we have our session will be on colorectal cancer. So today we have Dr. Suneel Kaushik with us. Dr. Suneel Kaushik, Senior Consultant, Surgical Oncology. So I would request you to give a glimpse on your expertise, sir.
Hello everyone. I am Dr. Suneel Kaushik. So after completing my specialization in oncosurgery, I have over 9 years of experience in oncosurgery. I have an expertise in treating head and neck cancers, breast, thyroid, thoracic and abdominal cancers, including the GI malignancies. I have experience and expertise in laparoscopic and as well as open surgeries.
So my first question related to colorectal cancer is, what are the main symptoms of colorectal cancer and when should someone see a doctor?
Most patients in their early stages do not have any symptoms. They can present asymptomatically and they can be diagnosed on some routine investigation. But the common symptoms related to colorectal cancer, that is the cancer of the large intestine, are change in the bowel habits. Usually, everybody will have their routine bowel habits like once in a day or twice in a day or once in 2 days. It is a routine for them. If there is any change in this normal routine, that is they may have increased number of stools per day or they may be constipated. Any change in the routine or the regular bowel habits could be a sign of colorectal cancer. There can be bleeding per rectum, that is there can be blood in the stools. That can be a small quantity or in large quantity, that is usually confused with the piles or also called as the hemorrhoids. So any blood in the stool should be evaluated by a surgeon or an oncologist so that the early diagnosis of cancer is not missed. Other symptoms are there could be a vague abdominal pain. In very late stages, when the early signs and symptoms are neglected, the patient may completely go into obstruction, that is the normal passage of stools gets completely blocked. Then this can lead to abdominal distension and vomitings. Sometimes there can be fluid collection in the abdomen that can result in abdominal distension because of water accumulating inside the abdomen. So the common symptoms are like bleeding per rectum, or there can be change in the bowel habits, abdominal pain and abdominal distension. These are the common signs and symptoms of colorectal cancer.
My next question will be, can you outline the key risk factors associated with the colorectal cancer?
It is very important for us to understand the risk factors of any disease. If we know the risk factors only, then we can avoid them. So the common risk factors like for any other cancer, smoking and alcohol abuse are the important risk factors for colorectal cancer. Next is the age. Age is the single most important risk factor because colorectal cancer usually develops in the late stages of the life, like after 50 years of age. So advancing age is also a risk factor. Then obesity and sedentary lifestyle. This is a lifestyle related disease. Obesity and sedentary lifestyle increases the risk of colorectal cancer. And certain dietary habits like consuming red meat, that is mutton, pork, etc., can also increase the risk of colorectal cancer. Apart from this, there are certain hereditary factors also. If your close relatives like your parents, siblings or cousins have a history of colon cancer or rectal cancer running in your family, then you may be at a higher risk. This is because of certain genetic changes that occur in the genes that can be transmitted from the parents to the children, that can result in increased risk, but this constitutes a small percentage of colorectal cancers. Certain bowel diseases like inflammatory bowel diseases also increase the risk of colorectal cancer, that is the ulcerative colitis and Crohn's disease increase the risk of cancer. If you have polyps in your large intestine, they slowly over a period of time can develop into colon cancer or rectal cancer. So if you are detected with polyps in your large intestine during a routine colonoscopy or sigmoidoscopy, it is better to get them removed.
So my next question will be, sir, at what age and how frequently should individuals undergo colorectal cancer screening?
Screening. What is screening? Screening is any test that is used to identify the disease in the very early stages, even before the patient develops any clinical signs and symptoms. So that is called as a screening test. So for colorectal cancer also we have certain screening tests. Like for example, we have a stool examination test. In the stool sample we detect for any blood traces of blood, so that which can increase the suspicion of colorectal cancer, and then further evaluation is needed in those cases. The other thing is an endoscopic evaluation called as a sigmoidoscopy or colonoscopy. These are the most commonly used screening test for colorectal cancer. As I have already said, the colorectal cancer risk increases commonly after 50 years of age. So in any average risk individual, that is who do not have any significant family history of colorectal cancer, in those patients we usually advise the colonoscopy, that is complete evaluation of the large intestine using the endoscope, every 10 years. And sigmoidoscopy can be advised every 5 to 10 years. And if somebody is not keen on getting a colonoscopy because of various reasons, then they may have a stool examination for the occult blood. That has to be done more frequently, every year probably, or at least every 3 yearly. This is not a very sensitive test for colorectal cancer, but it is slightly better than not getting anything done. This is for an average risk individual who has no family history. If they have a family history of colorectal cancer in their close relatives, then they may have to undergo it more frequently, probably every 3 to 5 years, after proper evaluation for any genetic mutations.
So my next question, sir. So what are the primary treatment options for colorectal cancer and how is the choice determined?
See, in colorectal cancer, we divide it into colon cancer and rectal cancer. These are treated differently. For colon cancer, the treatment options are surgery, which is the most important and the curative treatment of choice. Then some patients may require chemotherapy either before or most commonly after surgery, depending upon the various risk factors on the final report of the surgery. With respect to the rectal cancer, it is slightly treated differently in comparison with the colon cancer. So here usually the patients in their slightly advanced stages, they may have to be treated initially with radiation and chemotherapy, and later on after the tumor size reduces and it becomes more amenable for surgery, they will have to undergo surgery. But if they present in the very early stages, then surgery may be the first treatment option. So the stage of the disease actually determines the treatment options and as well as the sequence of treatment.
So my next question would be, sir, so can you highlight any recent breakthroughs or advancement in colorectal cancer treatment?
Yeah, there are significant advances in the last 5 years with respect to colorectal cancer treatments. So one is with relation to surgery, we have intersphincteric surgery as a recent advancement, like for distal rectal cancers, where abdominoperineal resection, permanent colostomy is the treatment commonly advised. If possible, we can do an sphincter sparing intersphincteric resection surgery so that the normal passage of stool can be restored. Then in advanced cases of colon cancer, we now have the option of giving chemotherapy initially and then later on proceeding to surgery. This has shown to improve the survival. That is one significant advancement. Then we have another thing called as the HIPEC surgery, which is a more complex surgery along with administering chemotherapy during surgery itself for more locally advanced colon cancer like T4 diseases. Then that has been shown to improve the survival. With respect to medical treatment, we have immunotherapy coming in a big way that has shown in selected cases of colon and rectal cancer has shown improved responses to treatment and improvement in the survival. And similarly with the radiation also, we have newer techniques that have shown to reduce the side effects as well as improving the efficacy of treatment.
What are the challenges do colorectal cancer patient normally face and how we can address them?
Yeah, see, the surgery for a large intestinal cancer will have stoma, that is the putting the part of the intestine on the abdominal wall so that the stool output is through the lower abdomen. So that is a big challenge. So that always interferes in surgery planning for us. So that becomes a main important stigma which the patients keep in their mind and that try to postpone the surgery. So there is a big challenge. But the most often this is a temporary stoma. That is something which these patients must understand. Most often, in if you consider in percentages, it is probably 80-90% of the times it is a temporary stoma. Maybe after 1 to 2 months after the wound has healed inside, then the stoma can be reversed and normal passage can be restored. But in some 5 to 10% of the patients, when the tumor is in the distal most part of the rectum and the anal canal, that could be a permanent stoma. But the stoma care is now having so many advances that the one who is seeing you from the opposite side will not even be able to recognize that you have a stoma. And the odor also can be controlled, and there will not be any hindrance to the social life. So many advances are there in the stoma management, and the stoma care nurses will definitely guide them and help them in the stoma management. The other thing is that usually the cancer treatments take little longer time, maybe some 6 to 8 months on an average. So adhering to the long treatment protocol is one important thing. So the logistical issues are there. So that can be discussed with the treating doctor so that those logistical issues can be settled.
So my next question would be, sir, like what are the importance of post-treatment care for the cancer survivors?
Yeah, so the cancer treatment does not end with the completion of surgery, chemotherapy and radiation. It continues for 2 to 5 years after the completion of this exact treatment protocol. Because the cancer is a type of disease which has the chance of coming back. If the disease has to come back, it usually comes in at least 95% of the patients within the first 2 years. So therefore, we have a stringent follow-up protocol for the initial 2 months, every 3 to 4 monthly. And we perform few blood tests, and depending upon the disease stage and the treatment that the patient has received, we may do some imaging tests also during the follow-up. And so it is very important for them to have a stringent follow-up care for 2 to 5 years after treatment. After 5 years, we consider them as being cured of the disease, and the follow-up protocol will be relaxed up to every 1 year. Then afterwards, some patients with rectal cancer may have a low anterior resection syndrome. That is a type of syndrome that the patients develop because of the removal of the rectum. So that is the distal most part of the large intestine. They may have increased frequency of stools, sometimes urgency also. So these things can be addressed by, and there are different treatment options for it. They can be, though it cannot be completely removed, the severity of the symptoms can be significantly reduced.
Thank you, doctor, for your valuable inputs. So we are closing this session for today. Till then, thank you and be safe.